You're listening to Eye on Health on Dubai Eye 103.8.
Delving into your overall well-being.
With Arab Health, united by business, forging ahead.
I'm Dr. Prasanta. I'm practicing medical oncology here.
Okay.
Oncology have a three branch. Basically, oncology have a three branch: medical oncology, surgical oncology, and radiation oncology. Those who are giving chemotherapy, hormone therapy, or the targeted and immunotherapy, they are called as medical oncology. Means cancer medicine. Those who are giving cancer medicines are called as medical oncology. So I'm one of them.
So, Dr. Prasanta, you're joining us, as you say, as a medical oncology specialist, and you practice at the Canadian Specialist Hospital. So you look at management of all different types of cancer. Can I ask you what attracted you as a doctor to this area of care?
After I completing my MBBS, then I did my postgraduate in medicine, general medicine. At that time, my mother suffered from some unknown liver cancer that is not diagnosed at that time. And she passed away within 3 weeks.
I'm so sorry.
So I decided that I should go to this branch because this branch have this branch have different aspects, both emotional and psychological. In India and if you compare in India or UAE and worldwide, the doctors in medical oncology fields are very limited. That's why I choose to do medical oncology to help people in India and abroad also.
That's a wonderful tribute to your mother. It really is. I'm sure she'd be so proud to know that what you do is born out of that love and sense of loss for her and how you help people. You know, I'm sure it doesn't get any easier giving someone a diagnosis of cancer. How do you find that part of the job?
When someone is diagnosed with cancer, then it is a shocking reveal. So we have to counsel the patient before we tell that you have this cancer or that cancer. After somebody come to me with some symptom related to cancer, I first assure them that cancer is treatable. First, my word is cancer is treatable. If it is early stage, it is curable also. After that, I counsel the patient regarding the test associated with the diagnosis, with the treatment, and with the outcome. Slowly, as the day passes, then the patient have a confidence that they will conquer this deadly disease.
You've got to bring in the right experts, of course, the right treatment plan. But I am a firm believer that, as you say, that belief and that mindset is so important. My dad has had cancer 3 times now, and he is an amazing, positive man who went into every single treatment plan with just the best attitude. You know, it was very much, you know, this is what we're going to do. This is the plan. I'm changing my diet. I'm doing visualization exercises. And he just went into it absolutely full throttle. There was never a kind of a victim mentality. And I think that is more important than we realize.
Very important. If you have positive attitude, then 50% of the treatment is completed.
So I think that's useful advice for anyone going through that diagnosis, and also the family as well. I think it's incredibly difficult for a family to get that diagnosis and to know how to support a patient, both emotionally and practically, because you're thinking about yourself. I know I was as well. I was thinking about, you know, losing my dad and what that would mean for me rather than being there for him. It's a very difficult time that, unfortunately. Can we talk a little bit about types of cancers that you've been working with and which ones you're perhaps seeing more of coming into clinic?
If you're talking about in UAE, the cancer incidence now is increasing. And surprisingly, it is increasing younger individual also. If you'll see, every day in UAE, 11 to 12 patients are diagnosed with cancer. And every day there is 2 to 3 deaths related to cancer. In the male, the most common cancer diagnosed in lung, colon, prostates. And in the female, it is breast cancer, then the genitourinary cancer.
And that early intervention, you know, as we all know, is just so important. And we do really praise the government for a lot of the education initiatives that are going out into communities, even rural communities, to make sure people are getting screened as early as possible. So that early detection is key. Prevention is also key. But what do we know about causes of cancer? Is there anything you can shed some light on there, Dr. Prasanta?
The causes of cancers are variable. It's starting from genetics, environmental, and dietary. If we'll talk about genetics, there is some defect in your gene that is hereditary. Hereditary means passes from generation to generation. Then second is environmental. Environmental means exposure to radiation or exposure to UV light or chemical carcinogen exposure. it may also lead to cancer. And the most important thing is dietary habit and the lifestyle, because the genetics we can't change because that is present since birth. But this dietary factor and the lifestyle we can change. So these are the modifiable factor. If we modify, then chances of cancer will be less, like tobacco smoking or alcohol or obesity. These are the things which lead to cancer in your later part.
Is there anything that you do or don't do every single day to keep yourself as healthy as possible? And ideally, yes, of course, prevent cancer. Is there something that you really identify as something we could all be doing?
Weight management and daily exercise. You can do exercise like walking, brisk walking or jogging, whatever. You have to maintain your BMI. Second, quit smoking and, if possible, alcohol.
Can you tell us about some of the cancer treatment options that are available here in the UAE?
After the diagnosis, you have to stage the cancer, whether it is stage 1, stage 2, stage 3 or stage 4. For example, if it is localized cancer, means localized to that organ, then it is stage 1 or stage 2. If it's spread to nearby organ, nearby area, then it's stage 3, and spread to distant organ is stage 4. So depending on the stage, there is treatment option. For example, if it is a small localized tumor, then first option is surgery. If it is spread to distant organ, then the option is chemotherapy or targeted therapy or hormonal therapy. In UAE, all the cancer modality treatments are available, starting from surgery, chemotherapy, targeted therapy, immunotherapy, and advanced radiotherapy and laser therapy also.
Can I ask you why some people have such a different response to the same treatment? You know, some people might have sickness or hair loss, and others seemingly just, sail through.
Yeah.
Why is that?
If you give chemo to a patient, chemo or immunotherapy or targeted, whatever, the systemic treatment, if you give somebody to same treatment to two individuals, for example, with the same stage, same cancer, after the effect, the cancer chemotherapy or targeted therapy or immunotherapy need to be deactivated in your body. The deactivation is done by some enzymes present in your body and in your liver. Those, for example, one individual have that enzymes level is very low, and second individual have the enzyme level is very high. Those individuals which have the deactivation capacity more, then they can get rid of chemotherapy. They clear the chemotherapy within a day or two, for example. Those have a less deactivation enzymes or the unable to deactivate the cancer chemotherapy. The chemotherapy is present in their body for longer day. Wow. In those individuals, the cancer side effects will be more as compared to those individuals who clear the cancer chemotherapy early.
So it is really such an individual basis. Now, thinking about treatments then, what happens if you can't afford treatments here in the UAE? Are there some options that we should be aware of?
There are different cancer support groups are there. For example, in UAE, we have Breast Friend of Cancer Patients, Angel of Mercy, or Pure Heart Program. These are the cancer support groups. They are helping the patient both financially and psychologically. And there are some pharmaceutical companies also. They are helping the patient. For example, one patient is not financially affordable for one treatment, cancer treatment. Then they assess the financial status of that patient according to financial status. If the patient is able to give only 10% of the treatment, so patient will give the 10% of the treatment. The rest 90% of the treatment will be given by the companies.
Doctor, before I let you get back to clinic, I'd love to end on a positive note, but I'd be happy to end on a realistic note and ask for your thoughts on the future. Do we think that we are ever going to live in a time where we'll be able to completely eradicate cancer?
Eradicate cancer completely is next to impossible. The most important thing is to screen the cancer and to diagnose the cancer as early as possible, because early diagnosis is key to long-term survival.
Dr. Prasanta, thank you so much for your time. You can be found, as you said, at the Canadian Specialist Hospital. Really appreciate it and wishing you a wonderful weekend ahead. Thank you.
More with Eye on Health coming up
on Dubai Eye 103.8.